People, I am Dr. Yash Bhatia from Apollo Spectra Cradle Sector 82. Today the topic of the day which we are going to discuss is what are the signs and symptoms of fracture or the reason of the pressure in the leg. Now what is fracture? First we should know that what basically is the fracture. A fracture is nothing but a break in the continuity of the bone. Now whenever the fracture breaks, it is not just that the bone breaks, it is the muscular injury, the microvessels injury and the skin injury and the soft tissue injury that may occur in time. So now the first tidal signs, the signs and symptoms of a fracture are: number 1, the swelling of the involved limb; number 2, bony tenderness is present, whether it be in a hairline fracture or being a displaced or undisplaced, tenderness is present. Bony crepitus means the movement of the bones is present. Abnormal mobility is present. There you will see a visible deformity. There can be a nerve involvement in which we can see the nerve injuries occurring due to fractures. This we generally term as distal neurovascular complications or distal neurovascular deficit. And the transmitted movements are also seen. These are the basic tidal signs of how, as a doctor or an orthopedic surgeon, diagnosis of fracture. Now suppose the fracture is in the closed compartment, suppose in the form of a leg. This raises the intra-compartment pressure of the leg because the closed compartment is closed, in which we would see a massive swelling, and the distal pulses which we would find would be feeble and not palpable. This is most commonly seen in the leg and in the forearm, commonly seen in the leg. This is considered as an emergency if the intercompartment pressure increases. Now for diagnosis of a fracture, the most important modality for diagnosing a fracture is: number 1 is an X-rays. AP and lateral views are the most common views that are being used for diagnosing of the fracture. These signs can be vary from patient to patient, person to person. The fractures can be of various classifications or various subtypes. They can be displaced fracture and undisplaced fracture. Undisplaced fracture, in the common man term, generally used as the hairline fracture, which just does not require anything but just immobilization. Now, the various treatments of the fractures depend on person to person, case by case, which we would further discuss out in our next consecutive videos.